And action. Hey, Robert had a question about caffeine before working out. And I think caffeine is helpful. But like any medical decision-making process, you have to weigh the risks versus the benefits of whatever you're ingesting or participating in. If this is the first time you're finding me though, please hit the subscribe button down below and the alert button to find out when I do the next videos. So, caffeine for exercise. Number one, everybody should be exercising. And as far as the sweet spot for exercise during the day, it really depends on what makes it sustainable for you. So I've heard arguments that nighttime, daytime, morning, evening, it really, to me, it doesn't matter. I see people in the long run over decades, and I want to make sure that they stay alive and avoid the big crap that's coming, heart attack, stroke, and cancer, depending on the age group. But sometimes when it comes to exercise, I usually get up about 5 o'clock, 4:30 every morning, and I try to make my way to the gym Thursday, Friday, Saturday, and Sunday. And those are the only mornings I can do it. And I never liked exercising in the morning, but now it's my rhythm. And truthfully, it's the only time I have. So exercising in the morning is tough if you're not used to it. So as far as the question about Robert using caffeine, I think it's okay. Jay Hoffman out of University of Central Florida, where I used to be the team physician, did some great studies on the benefits of caffeine in people who do exercising, athletes. And there is an improvement in performance of strength. There's definitely a improvement in perceived exertion, but again, the question is, if you take in caffeine, number one, how much you're going to take in. Number two, will you have problems later on? So if you're going to use caffeine before an exercise or a workout in the evening, that caffeine isn't just going to stop after you're done your workout in an hour and a half. For me, 20 minutes. But so you have to be careful. If it offsets and screws up your sleep, you just screwed up your rehab process or the rebuild process of the muscle. So if it gives you palpitations, if it gives you anxiety, if it makes you have diarrhea, if it gives you an upset stomach, if it adds to the reflux that you have, or if it makes you urinate. And this is one of the things that you have to understand. Caffeine is a drug. It happens to come in coffee bean and a little bit in tea. But it's a drug and it causes side effects. Biggest side effect is stimulation, which is kind of what we're looking for. But the other side effects are excessive urination. It's a diuretic. Palpitations of the heart because it stimulates the beta receptors in the heart. Increased blood pressure because it stimulates the blood pressure receptors in the blood vessels. So high blood pressure, palpitations, skip heartbeats, and then anxiety because it stimulates the brain. So all those should be taken into account. If you already suffer from all that stuff, it's not worth it. If you don't have any of those symptoms and you're going to use caffeine, cool. Remember, as I mentioned, caffeine in the form of coffee also causes or adds to the reflux issue. So make sure you're not peeing off too much. Make sure that you're not having too much of a problem with reflux the next couple of days. And again, sometimes you will notice the symptoms, the side effects right afterward. Sometimes you won't notice them until later on. We're all trying to do this exercise thing to become or have longevity, avoid the heart attack, stroke, and cancer. So if it's getting you there requires overstimulation, this is what I would say. So caffeine does help. If you're interested in not using caffeine, there are other substitutes not as impacting, but D-ribose is a sugar. Jacob Teitelbaum made it popular for fibromyalgia sufferers with fatigue. I think it does help. It's not as impacting, but it does help in the long run. Usually 5 grams of powder in the morning, and sometimes if you put some B12 into that, it gives you a little bit of a boost. Now whether that's placebo or not, I don't care. If it works, it works. Rhodiola is an herb that stimulates or supports the adrenals, but stimulates the blood pressure and the heart rate too. Again, not as stimulating as a cup of coffee, but it does work. I put down Metallica here because I think that if you can stimulate the 5 senses to also wake you up and get your adrenaline going, you can tell the brain to turn on the adrenals and get moving. And when you stimulate the adrenals, it stimulates cortisol, adrenaline, norepinephrine. And those are useful for fight or flight hormones, but they can also be useful if you're trying to initiate an exercise routine and get charged up. So I listen to Metallica, Saliva, POD, Van Halen. Those are my those are my stimulants with the mind that get my adrenaline going. And then I try to think back and have a guided imagery about when I used to be bodybuilding and powerlifting and sprinting. So those things are very powerful, but you have to practice that. You have to call them in. If you don't have that kind of a guided imagery before you do your 1 rep max or before you work out, have someone design that for you. I have a good psychologist I can use, or you can find your own. Finally, if you're going to do energy drinks, I don't like that. That's highly processed stuff. I mean, technically D-ribose is processed, but those energy drinks that some people will tout, 5 Hour Energy, Red Bull, highly processed, supposedly no caffeine and no sugar in some of them. I don't know that I trust that. So the problem with those is that, yes, you can have a big caffeine hit or a stimulant hit, but you also have the crash afterward because of the process steps that have to take into account how to get all that drug or lookalike drug or herb into the bottle. I don't like the crash part. I think it'll be detrimental to what you're trying to do is build up muscle and calm the brain. So I just take espresso if I were you. Again, watch your palpitations and your reflux. Finally, my biggest suggestion is the best support for a really good workout, especially this morning, is to have a good night's sleep. If you can't support the sleep, then you're going to have a tough problem with starting the exercise program in the morning. So there's things that I do for sleep to support the sleep. See my video, DrRic Question Sleep Ritual. There's also herbs for sleep, 5-HTP, melatonin, ashwagandha can be used at night. Other things to calm down, skullcap, passion flower extract, CBD, medical marijuana. All these things help to calm down the night so that you have a good night's sleep, you are well rested. The brain, when it's rested and the body and the limbs are paralyzed essentially, you can have muscle rebuilding, or you can get charged up so your adrenaline's ready to go when you're starting your exercise program in the morning or whenever it is that you start your exercise program. But I hope this helps, Robert. It's a good question, and I think a lot of my patients are subscribing to a lot of things to stimulate a workout that are just not healthy. So thanks for listening, and I'll see you in the clinic.